Welcome, doctors. Today, we're diving into an essential topic for your practice: Wegovy eligibility and prior authorization. As you know, prescribing weight loss medications like Wegovy isn't as simple as just writing a prescription. With insurance, there's a lot more involved, especially when it comes to eligibility verification and prior authorization, PA. How Zappy Health simplifies the entire process, ensuring your patients get access to the treatment they need, without delays or denials. Let's start with why this process is so critical. Wegovy, as we know, is an expensive medication, and insurance companies have strict criteria on who qualifies. If the proper documentation isn't submitted, or if coverage isn't verified before treatment, it can lead to costly claim denials, unexpected out-of-pocket expenses for your patients, or frustrating delays in getting the medication they need. So, how does Zappy Health make this all easier? Well, they've developed a seamless, tech-enabled process to handle Wegovy access. Here's how it works. First, virtual intake and evaluation. Your patients fill out a digital form and then attend a video consultation with a Zappy provider. During this consult, they determine medical eligibility based on factors like BMI, and any previous weight loss attempts. Once the prescription is written, Zappy's team takes over with insurance verification. They'll access the patient's insurance portal, check if Wegovy is covered, confirm the plan is active, and determine if prior authorization is required. If PA is needed, Zappy will compile all the necessary documentation. This includes BMI history, failed weight loss attempts, comorbidity documentation, and any prescriber notes. They'll submit everything via the insurer's preferred method, whether that's an electronic portal, fax, or secure email. They'll track the status of each submission and follow up with the insurer if approvals are delayed. And if a PA is denied? Zappy is right there to help with the appeal process or explore alternative treatment options. Ensuring the medication is shipped to your patient promptly and that refill automation kicks in to guarantee continuous therapy. Zappy verifies several key details during the process. This includes the active status of the patient's insurance, whether Wegovy is covered under their plan, and the out-of-pocket costs like copays or co-insurance. They also confirm whether a prior authorization is needed and check for any special restrictions like age, or required step therapies. Now, when should this process be done? Zappy gets to work immediately after you prescribe Wegovy. Insurance verification and PA submission are completed on the same day. Best practice? Always ensure that coverage is verified and PA is submitted before the pharmacy processes the medication. Zappy also ensures coverage is re-verified at the start of each plan year, or if a patient changes insurance plans. One of the things that sets Zappy apart is their use of technology to make the process more efficient. Zappy uses real-time verification tools like Eligibility to instantly check insurance coverage and benefits. Their system also automates refill tracking, sending timely alerts to make sure your patients don't run out of medication. And let's not forget the AI-powered chat assistant that helps guide your patients through the insurance process, answering questions and keeping them informed. Of course, eligibility verification and PA for GLP-1 medications like Wegovy can be challenging. There are often delays in approval, missing data in the initial submission, and pharmacy-related issues. If there's a delay, they're on top of it, following up with insurers and pharmacies until the medication is in your patient's hands. What did we learn today? Navigating Wegovy's insurance process doesn't have to be a headache. With Zappy Health, eligibility verification and prior authorization become seamless, giving your patients faster access to this life-changing medication. And for you, it means less administrative work and more time to focus on what truly matters: your patient's care. Thanks for tuning in, doctors.